Vamos, juguemos. A veces no, a veces yo prefiero. Si tú me lo pides, yo no me muevo. Que 5 minutos se hagan eternos. Quiero, y aunque no debo, renuncio al mundo y a sus relojes. Batiendo mis dedos con muchas flores. Quiero, que aunque es un juego, te lo imagines junto a mí. Te quiero, sin puntos ni te veo y no cambio nada en ti. Te quiero, sin puntos ni te veo y no cambio nada en ti. Te quiero, sin peros ni no sé decirte no.
Hi, everyone. I think it's okay if we go ahead and begin now. So first and foremost, it's so great to see you all today and to be in community with you all on this wonderful Tuesday night. We at the LRC, the Latinx Resource Center, are so grateful to be able to be sitting alongside esteemed Dr. Christian Anguino, also an alumni of the LAFA Social Support Group at the UCI, and also a graduate of the 2006 graduating class. Today, Dr. Christian will be sharing his presentation on our healthful existence is as resistance, self-care and wellness practices as queer and trans people of color. And to briefly introduce myself, my name is Manuel Teran and I use he, him pronouns. And this year I'm serving as the QTPOC programs intern at the UCI Latinx Research Center. And with that, I'd like to begin just by providing a brief introduction about our esteemed guest today. Dr. Christian Anguino is a naturopathic doctor currently practicing naturopathic medicine in California and Arizona. He received degrees in biological sciences and Chicanx and Latinx studies from UCI in 2006. His work today involves urgent care clinic operations as a primary care provider for a predominantly Latinx, Spanish-speaking, and uninsured patient population. And with that, please all help me today in welcoming Dr. Christian Anguino.
Hi, everybody. Thanks, Manny, for that intro. We got to speak a little bit over the phone not too long ago, so it was nice to meet the current me from back in the day. It sounds like, which is awesome. I'm like, oh my God, that was me like 15 years ago. But so yeah, thanks to the intro. As you mentioned, my name is Dr. Christian Anguiano. I'm a naturopathic doctor, and that might be something that's new to most of us here, the idea of a naturopathic doctor, because we've heard of, your MD, which stands for medical doctor. We've heard of DO, maybe that's the osteopathic doctor. And then there's DC as well, which is your doctor of chiropractic. And then there's also naturopathic medicine and naturopathic doctors. And so the way to think about that is, if it's on a spectrum, on the far right, I like to say is MDs, and then the MDs and then on the other side, right, of the spectrum are doctors that work more on the fringe. So from MDs, then you kind of get into like the MDs that do more integrative stuff, and they're open to other things that aren't just pharmaceuticals, right? Because they learn a little bit more about what else is out there a lot later in the game, but they're MDs, and then DOs do a lot more of that whole body health care that I like to talk about. And then the DCs start to do some of that too. And then you start getting into the NDs, who are a lot more our philosophy is a lot more uh, interested in the more the like what's considered complementary or alternative medicine, which I don't like to say it that way because that's going to start to insinuate that we are an option, an alternative option, when in reality, for we could be what somebody needs, you know, first and foremost, versus going straight for something like a pharmaceutical that oftentimes doesn't really treat the cause of somebody's concerns, but more so just symptoms. And that's the big idea there. So naturopathic medicine has been around for a really long time. Um, for me, it's not an alternative. It's something that could be done as a first, um, you know, treatment option. Though, as an naturopathic doctor, also we know to be integrative in our approach, and what that means is just that you can and you should be able to use certain pharmaceuticals if the situation calls for it. So if somebody comes into the urgent care where I work in Arizona, they could come in with an infection that needs something that is going to take care of the infection quickly, or the patient might be more at risk for more serious issues happening. So, but there's a nice balance, right? So if someone comes in with that, there's a way to treat their whole body so that you're protecting them from the use of certain medications that might cause other issues. So that's kind of where naturopathic medicine comes in. So I do want to talk about, because I think it's important to think about the way that we see our health in a way that's not just reactionary. So if you're sick, then now you need some kind of intervention. And what naturopathic medicine does is that you're able to start doing a lot of things now to help and to create better health for yourself now in a way that's more preventive. So I'm all about like disease prevention. I worked for the very first thing I did outside of when I graduated from UCI was because I learned late in the game. So I was pre-med all through undergrad, and then I learned later on, like in my fourth or fifth year at UC Irvine, about the looking at healthcare from more of like a social science lens and seeing what are the specific needs of Latino population, or the specific needs of maybe like a queer Latino population. And then that kind of all comes back to public health. So that's now looking at healthcare as in ways that are more preventive, and also the field of public health lends to that more so. So then I got really into working in potentially public health field somehow. And so my thesis before I graduated with what was then called Chicano Latino Studies was to think about something that would integrate Latinos and something LGBT, and something that was more public health related. And back then we had a few professors that we worked with as young, you know, LGBT Latinos. And one of them was a professor named Dr. Deborah Vargas, and she ended up being my mentor in my thesis. And so we talked about what was happening at that time a lot were what are known now still likely are the pumping parties within the transgender Latina community. So what this is then is because for a lot of people who are trans and come to the States and, you know, seeking refuge, and they also still are trying to transition, right? So they come and they don't have access to a lot of the same resources that other trans people have. Still, even though there's limited access, they might have it just a little bit more access, because with trans Latinas who are undocumented, it just becomes a little bit more difficult. So they often were in the news at the time was a lot of, there was a specific event that happened that where a woman lost her life because of the injections. They would typically use industrial grade silicone injections because they're going to the black market. They're going a little bit more underground to get the tools that they need for their transition. So that for me was very formative, in that I got to think about health and what I want to do as, you know, potentially a doctor someday, but also thinking about health disparities, specifically within Latino and Latinx and, you know, and the queer community. And then looking at it through a more public health, disease prevention, more preventive way, right? So that to me was the most was interesting. And so that I bring up because it was through LAFA in those early days, and it was through this professor who got me to and you know, got me in order to do to and organized to be able to do something like that, research project that would require me going into the community and talking to the right people and making the right partnerships with the right organizations and the right activists, you know. And so that was really important. So the so then we have now we have for me what was LAFA at the time, and I'll go more into how that was when I was you know what the how that a group worked out. And then I had the professors that were really helpful that we had back then. I'm not sure who you have now to help, you know, guide you in different projects. And then I had the community behind me too, because I ended up making some key connections outside of UCI to help me with figuring out because when you're doing a thesis like this, you are figuring out for yourself what is going to be your likely your future work, more so than you're actually doing a whole ton of good, you know, in the community. So with, you know, with the people that you're reaching out to help you with whatever, you know, with your academic work. So at the time then, I know it's a lot, but I'm just trying to frame kind of like where, you know, how all of that relates to just the work that I'm doing now. And so, and hopefully this also gives you an idea of what it was like to back then for the LAFA group at UCI. And I know that there are some of us here now on the call that I can see that are going to also give a talk in the next coming weeks. So it's good that they're here so that in case they think I'm lying about something, they can be like, no, you're lying or whatever, but that's not what happened. So back in the day then, this was 2001 or 2001, 2002. No, it'd be the fall of 2001. The Mecha chapter back then um, was different from it changed up in a matter of in less than a year, in a matter of a few quarters we were able to change the direction of where Mecha would go in the coming years. And that was because we had some key people that came in as fresh people, as you know, that came in as first years and really shook things up. And and I would say I'd put myself in that group, that first, one of those first people, and Dulce, who's also on the call here, and Liliana as well, if you can see they're on here to show you those faces. But Dulce and I were the first years that year, and we just we decided to early on to just be unafraid in a sense, because we had each other. So we went to the Mecha meetings, and then we would be ourselves, and we'd be out, and we'd be like we'd be very LGBT and very loud about it. And at that time, Mecha likely wasn't entirely ready for it, because it did shift the way that the membership was was comprised of at the time a lot more cis men and no LGBT people. So when we decided to come out, and there are other factors that influence that too. That influence that, in that, you know, there was somebody at my dorm room who felt comfortable with being openly myself around. And then that kind of like just, you know, at that point I brought that toward to Mecha. I never once maybe at the beginning felt like uncomfortable with being myself, but then having the support of somebody like Dulce, for example, who was in that same kind of in that same place as I was, then it really just made it easy. And so what happened in Mecha was that people who weren't comfortable with that literally picked up and left. But it was fine for us, because then we got the opportunity to shape it the way we wanted it to be. And one of those things was to create a La Familia chapter at Mecha the UCI at the time. LAFA already existed at other schools, and that's kind of what we molded our group off of. And we were able to, at the time, go to all certain conferences that were happening at other schools. UCLA had one, and I want to say there were at least a couple others where they were LAFA specific, or LGBT specific. So we had a lot of resources at the time to really just kind of launch, the LAFA chapter at UCI. And then because MedChad leadership had shifted so much, and we had the space to just put on different events that we wanted to see that were LGBT specific. We had a lot of support from professors in Chicano Latino studies at the time. I would say a couple, but that were really supportive though. So then they, for example, would even have classes on like queer, Latinidad, and I took there was another one, another professor, and I'll say his name here too because Dulce and Liliana will also know who they were. It's his name was Professor what was his name? Gradilla. And so he taught some really cool classes at the time, and I'm not sure what you all have now, what you've been able to take, but back then there was a class that where he exposed us to things early on, like Paris is Burning as 18-year-olds, which was very for us formative. And so we felt like there were people that were that were leading the Chicano Latino studies at the time that were open to our ideas and wanting to teach us certain things that we wouldn't have otherwise known about. So again, I say these things and I'm trying to say as much as I can now so that if any of you feel like, yeah, dang, we don't have that, or we're not getting that, or those classes don't exist, or what was the curriculum for those classes? What was it like? What books did you read? What films did you watch? Like all of that, I'm willing to dig back and see what those were, and also share that with any students who want to know. And I'm curious too to know what kinds of classes are being offered in the and what was then the Chicano Latino Studies department. And if there's, if there's any crossover with their queer studies, if that exists, or women's studies, that would be good to know. And so back then, we did have LAFA. It did a lot of work. We did a lot with it because there ended up being just people coming out of the woodworks that wanted to be a part of the group. And a couple of years in, we'd get new members that they got to just show up, and it was already created, and they were able to come in, and already things were in motion to where they were able to benefit for some of that work that we did. So the other thing that I will say back then, so we did have, like I mentioned, LAFA, that was super important for just a supportive, just like I would say we called it a support group, but it was group therapy, like we got to really talk to each other about what it was like to be queer and Latino. And then we also had some support from professors that taught us some things, right? But then also we went out into the community and we really got to know certain people that I believe are really helpful as well. And back in 2001, 2002, there was a group in Santa Ana called PFLAG in Espanol. And PFLAG is the parents, friends, and families of lesbians and gays. And that's how the acronym came about. They don't really stick to that acronym anymore. If you try and go to their website and see if they can, if they spell out the acronym, they don't. But then I think because they're trying to also evolve with the times, but they're just so well known as PFLAG that they kept that acronym. And so PFLAG in Espanol was a group in Santa Ana that was led by a woman named Leonor, who also was part of a film back in the day called De Colores, which is a film that existed on VHS. Like no joke. We had to, I think maybe eventually we got it on DVD, but this is like almost 20 years ago, right? But the woman that was one of the ladies that was on that film led the group in Santa Ana. So what they did was it's a support group that happened on Wednesday nights, and they were it was just like the name says, parents and friends and siblings and family members of LGBT Latinx folks. So we decided to do a film screening of that De Colores film at UCI, and we got the Chicano Latino Studies Department to sponsor it in a way that they told their students that if they came out to it, then they would get extra credit. And so we had it at a venue that ended up just being packed, which was awesome, right? For like a LAFA event, we had all these people that maybe were forced to be there, but they got to watch the film. And it was cool to be one of the organizers for it because the room was packed, right? So that was for us a success. But what happened that day was we had Leonor come, the lady from the Decolores film, and my mom went. And so, and I say that because it's one of those early things. Like I just come out and to my mom like the week or so before, not too long before, and then I'm like, well, there's this event that we're putting on, so you should come watch it. And then so she went, and she was open to it, and then she met Leonor there, and then and that same day after that screening, a bunch of us went to dinner with my mom as well. So then we got to already start to see each other and interact with our families. And that kind of opened the doors for each of us to bring our own parents to the PFLAG meetings in Santa Ana. So then that ended up being every Wednesday. It would be somebody new, whoever was ready would bring their parents to the group, and it'd be every Wednesday. And my mom became like very involved in it. There were Wednesdays where I'd be studying, I'd be trying to get, work done, and she'd call me and say, "Are we going or what?" Because I'll go without you. So she would literally go to these meetings without me, and ended up being kind of like one of the big allies at the group, and helping other parents. So for me, there was, like I mentioned, there was a support group from LAFA and La Familia. And there is, and in a way too, from the MECHA, the UCI chapter, because it ended up being one and the same. Like we took over. Our LAFA leadership was MECHA leadership. So we had that support group, and then we had the support from professors, I would say. Not a whole lot of that, but there was some. And then there was our involvement with community groups. For me, it was the PFLAG in Espanol, but also the trans Latinas that helped me with my thesis paper. They were all part of an organization called Bienestar at the time. And they were also, there was a group called Transgéneros Unidas that was like a subgroup in Bienestar. And that group now is led by the same person. It's Bambi Salcedo. She's a trans activist known all over the country. People know who she is because she's just that good at what she does. And the Trans Latina Coalition is growing. And so, sorry, that Transgéneros Unidas turned into the Trans Latina Coalition that Bambi now runs, and it's growing. Like I just met with her the other day, and she was telling me about all the different things that they're doing. So these groups still exist. So it's just a matter of trying to find out who still runs them, and then helping everybody who wants to know more about how to get involved. And I'm hoping that I can be that person too, so so that's kind of like my background with what it was like to be in LAFA in those early days, and then kind of how that led me into doing more of like like I said, I was pre-med, but I was more interested in doing more disease prevention work. And so then I got into the work with, with the Bienestar group. Though it wasn't a whole lot of work. I could have done more. I always think I could have done more, but it was what I needed to kind of just get through that phase in my life. And then afterward, I worked with an organization called Latino Health Access, and less LGBT, but it still kind of stuck to Latinx health, public health. And so then what I ended up doing was, I worked with them for some time, and then I decided to go back to doing more of like a one-on-one kind of doctor-patient relationship work, and nothing really fit for me. Like I lost interest in working for a hospital, for example. Like I didn't want to be in the hospital setting. I started thinking differently about healthcare and looking at it more as like a larger kind of like the whole healthcare, conventional healthcare model with the pharmaceutical industry, and then seeing how I didn't want to be a part of that, but also wanting to still do something that was related to being to having that doctor-patient relationship. And then I found naturopathic medicine, which for me was exactly what I wanted to do, which was still have that doctor-patient relationship, but also making sure that we are thinking about prevention first, you know, and then when something does happen, what is the least invasive way to deal with the situation before having to use pharmaceuticals, before letting it get to the point where where you need to go more invasive. Invasive means just having to, you know, cut somebody open, right? That's like the final step in that. But so naturopathic method or naturopathic medicine is that. So there's a whole list of our principles that we follow to when we are wanting to help somebody. There's 6 principles that we abide by to kind of guide our philosophy. And then there's something called the therapeutic order as well for naturopathic medicine. And that kind of gives you a step-by-step of how when you see somebody, like what's the first thing you can do to help? And then that goes down to the most invasive thing that you can do to help them. So does anybody are we waiting for questions at the very end?
I think that should be fine.
Okay, so I want to go to my my share screen so that I can show some things on that I'm going to talk about. Let's see. So y'all haven't seen this yet. This was the first slide. And then let's see if I can, here's the second one. So yeah, this just a really quick, just to go through these. Work focuses on disease prevention. Currently, I work for the clinic in Phoenix, Arizona. And like I mentioned, or how Manny mentioned when we started, the place is called Centro de Salud Familiar. So it's an urgent care primarily, in that patients come to us when they're really sick. So our patients are Spanish speaking, they're underserved, they're uninsured, they're undocumented mostly. And so they come to us when they are sick to the point where the next step is the hospital, and they don't want to go to the hospital because that would mean just it costing more money, right? So they come to us, and sometimes it's almost too late. So we have to really be good about giving them the right care, and that they're going to be given certain pharmaceutical interventions if necessary. But because they come to us once, they end up coming, like, so if someone comes in and we treat them for something like a throat infection that's acute, right? We also test their blood sugar, and we also test their blood pressure. And so if those things come out of range, then we have to be their primary care providers as well. And so we do labs, and we get them on medication to treat really high blood sugar, for example. And then they end up being in our care. So that's but then they're a captive audience too. So you're able to teach them things that they probably wouldn't otherwise know, right? To help them manage their high blood sugar, their high blood pressure. So there's a lot of static. Is that me? No? Okay.
We don't hear any static. You sound clear.
All right, awesome. So, and that's my work in Phoenix, Arizona. I go there once a month. That's where I did my residency as well. I really love the patient population that we would get to work with there. But what I do in Santa Monica here in LA, and I'll be expanding a little bit further down because right now I'm in the West Side, but I do a lot of nutrient hormone optimization. So if somebody comes in with a certain set of symptoms, then you want to test for things that maybe other places won't think to test for right away. And that's often being called functional labs testing, or functional medicine, in that But we call it naturopathic medicine. We call it digging deep for our patients and not just giving them something that's going to just treat their symptoms on the spot, right? And so I do, if somebody comes in and they might have something that looks like a thyroid issue, you want to test the thyroid hormone appropriately to see if it's how their treatment's going to be. It's going to depend on doing a proper workup for thyroid, for sometimes certain sex hormones, we also do a lot of cardiometabolic workups. So making sure that somebody's, so when you test for something like cholesterol, you're not just testing like the basic panel. There are ways to get more information for your patient, and that's in a way that's more preventive. So, that I call that nutrient hormone optimization. And then also I like to do what I call culturally competent whole body naturopathic care. So whole body health is looking at the patient and thinking about their physical health, their mental health, their emotional health, and their spiritual health. All those things are applicable when you're seeing somebody for something either, I would say, for acute to chronic. It's always important to know what are those factors that are contributing to their health status. So when you look at somebody, when you look at healthcare in that lens, when you're thinking more about disease prevention, and you're thinking more about what nutrient or vitamin deficiencies do they have that's contributing to their health. What are the hormone that might be off that other doctors maybe aren't testing for appropriately, so that you can figure out what's going on. With that, I'll put in what are some tests for cholesterol, or what are for some specific tests for inflammation or for your heart health, that is going to give you more information for your patient than just what's seen on the surface with basic blood work, right? So that's just, and all this is really cool to do in the setting like in Phoenix, because they don't always get this, right? They come to us and they're able to see naturopathic doctors that are trained on with in the conventional model, but can also think a little bit deeper. And so oftentimes I get really excited at work because a little old, like viejita comes in, Latina, or and she is likely dealing with some chronic disease stuff, and no one's explained her disease process to her in a way that makes sense, or nobody's dug a little bit deeper to figure out what's causing certain things to happen, or certain health issues. So that's how I apply everyday naturopathic medicine to just what I do with the Latino population, Latinx population. I also help still as one of the supervising doctors with Naturopaths Without Borders. And this is an organization I've been involved with since 2011. And what we do is we bring this same kind of model of naturopathic care to a small population in Rocky Point in Puerto Peñasco, Mexico. It's about 4 hours south of Phoenix. And so there we set up shop. We bring pharmaceutical intervention, and we also bring an entire medicinary of different natural therapies and acupuncture and physical manipulation. So, adjustments and what a chiropractor is trained to do, we can also do. And then some basic, just kind of things that we might need to dress a wound, or to help somebody who comes in that has an ulcer on the leg that isn't healing and they have nowhere else to go. So that's all work with Naturopaths Without Borders. And I still do that from time to time as well. And the next trip, for example, is later this month. So you can apply. What's really cool about naturopathic medicine is you can apply it here, in the States, but also because there's not a whole lot that you need when we're doing our, when we're able to see somebody using naturopathic modalities. You don't need a whole lot of money for it. It's something that could be done in places like Haiti, that we also work in Haiti or in Mexico for, and people really benefit from the care that we are able to provide. So I talked about a little bit already some of the stuff that kind of shaped my coming out in quotations, right? So we talked about, just really quick, I might be repeating some stuff, but just that you see, yeah, we covered everything here. I would say one thing that I didn't touch on when I talked about community and in my coming out process was queer nightlife, which existed back then for 18 and over. Um, so we would literally, and Dulce is still on, we would get out. We would go from Irvine to LA to make sure that we were being um, in, introduced to the larger LGBT community with each other, and that was important too. And some other things that I missed here too. This we can cover in a bit as well. If anybody has questions on what's listed here, and if you haven't, like I said, if you haven't received a lot of these things through your curriculum with your Chicano Latino studies or queer studies or women's studies, let us know. We'll create something that we can package and give to you. So otherwise, I covered most of this here. And then so going back to the naturopathic medicine. So here are the principles that I was talking about, and I can expand on these if someone has questions at the very end so that I can go on and talk about the last part of this. And so really quickly, our principles is to first do no harm. You don't want to cause more disruption to somebody who's trying to heal by giving them a medication that might make things worse, for example, or doing something that's very invasive that might make a situation worse as well. We talk about the healing power of nature a lot. So this is using things like botanical medicine or using proper like nutrition different things where we're able to use nature to help the body heal itself in a lot of ways is what we do. And then again, identifying and treating the cause versus just giving somebody a medication or even a supplement or something that's going to treat just the symptoms. You got to go deeper. Doctor as teacher is another one. So this is when you have a patient, like I mentioned, that comes in and doesn't know a whole lot about their disease process. This is your chance to sit and talk to them and explain it to them, because that helps the patient become empowered to be able to manage their disease better, for example. And then treating the whole person. Again, you want to treat their the physical manifestations of their disease, but you also want to think about their mental health and their emotional health as well. And then that's supposed to say prevention. And again, that's always thinking about how to prevent disease, the disease process from starting or advancing. And so, and on the right of the screen, you'll see all the different naturopathic modalities that we could utilize. There's clinical nutrition, botanical medicine, homeopathic medicine, which I can explain if somebody has questions about that. Hydrotherapy, so that's using water in varying temperatures and in varying applications to help with disease as well. Mind-body medicine, this is, for example, if just therapy or cognitive behavioral therapy or using different therapy methods. Minor surgeries and their physical medicine, like I mentioned, this is your being able to manipulate. So manipulation and physical medicine in the way that a chiropractor might do it. So adjustments to bring alignment back to the body. Parenteral therapy and nature cure. So just that we can get to the rest of this here. So then I wanted to talk about some queer, trans, and people of color health challenges. And I did this, if somebody, I wish we could have more of a discussion on this too, is kind of bounce back, like what are some things that you see that fall under what are, some of the factors that affect your physical health, mental health, emotional health, and spiritual health. And for QTPOC, especially students, and when you're out, and also growing up, right, in the homes that you grow up in, but when you're out as students and in at the university or wherever else, you want to make sure that there's going to be that you're going to feel safe in public spaces. So that's a big concern, that you're not going to be, that your safety in public spaces is taken into consideration. So also with your physical health, there are things that you'll start to be presented with in terms of safe sex, and I have safe sex in quotes because that for some people can mean different things now with the advent of something like PrEP, for example. But safe sex practices around and how that is affected by our feelings of shame, right? Which again goes towards the mental health issues that we might face as QTPOC. And then poor self-care habits. So making sure that there's sometimes, because there's less of that, maybe if you're not fully there yet, right? If there's some feelings of shame or low self-worth, you might not be taking care of your physical health in the way that you should be. And that's just, eating the right foods and exercising. So treating your caring for your body in those ways, drinking enough water, getting enough sleep, managing stress appropriately. So all of these things might be, you might not be thinking so much about because there are some other things happening at the same time where you're not prioritizing these things, right? So, and then also the physical manifestations of stress, that's really important too. So, because as QTPOC, we have certain stressors that other people might not have, right? So these stressors over time, especially if they involve some kind of, you can see under the mental health category, there's certain stresses around coming out. There are certain stresses around just trauma of being somebody who's not openly themselves and maybe getting it from certain family members or other people. So the stress around that and the trauma around that can cause a disruption in your physiology. And this is something that I talk about a lot, is that there's something called the HPA axis, and that's where your hypothalamus communicates with your pituitary gland, that communicates with your adrenal glands to regulate how your body releases the hormone cortisol. And cortisol is your stress hormone. And so we need it for a lot of different things in our bodies. So if we want to think about cortisol, and when we wake up, we need enough of this stress hormone to get us up and awake and alert for the day. So when we wake up, the hormone, the cortisol should be a little bit on the higher end. And as the day progresses, that cortisol starts to come down in a curve, kind of like a slide. And at the end of the day, your cortisol should be at a lower amount, because then you're less awake and less alert and you're able to go to bed. So that's like a normal cortisol curve. When there's a lot of stress, and then when somebody's not taking care of the adrenal glands, again, part of that HPA axis, then you start to be less efficient in your ability to put out cortisol when you need it. So then that curve might just start to look a little bit more wonky, so that cortisol now is a little bit low when it needs to be high, and then it's high when it needs to be low, and then it's high again at night, and you can't go to bed. So this is from, again, a lot of stress, the chronic stress or some trauma that's turned into just a lot of this chronic stress that starts to throw off the way that your cortisol is functioning throughout the day, or the way that your brain communicates with your adrenals. But this is important for us because, again, if we have all this unresolved trauma, if there's a lot of stress around just being who we are and being happy and thriving, then we end up having that curve no longer be just a nice slide. It ends up just being kind of like a flat line almost. And so over time, then that cortisol is just chronically low. And then it's low until something really traumatic happens again, and then you get a huge output of cortisol and you don't know how to cope with that. So this is why I always stress with a lot of people, it's like you have to think about your different stressors. And then if if a lot of the stress is coming from unresolved trauma, or maybe just things that you experienced growing up in your household, or being, LGBT or QT, or queer, and then you want to really want to figure out how to address those stressors, and also take care of that HPA axis and give a lot of support to your adrenals. Like that for me is like, if I can drive home one message, it's that, because the when you start having chronically low levels of cortisol, like again, you don't have a whole lot of cortisol, you're not able to react to stress very well anymore. Now you're going to have other physical manifestations of that, because cortisol is the stress hormone, but it's also necessary for other processes in your body. So you want cortisol to be in the appropriate amounts, because it helps to regulate your blood pressure and your heart rate, helps to regulate blood sugar as well. It's necessary as a way to combat everyday inflammation. So it's very anti-inflammatory. It's also necessary for your immune system to function appropriately. So when you start having a lots of stress, a lot of just mental, emotional stressors, a lot of unresolved trauma, now your cortisol suffering from it. Now you're also more prone to be having blood sugar dysregulation, or maybe getting sick a little bit more often than you otherwise would be, because your immune system's down. So all of that comes down to making sure that you are taking care of some of these stressors. And I'll show you a figure at the end of this talk that goes into what you want to think about when you think about potential stressors in your life. So then I also put here for you want to look at your emotional health, right? And again, some people don't have that community support, that emotional support from their community, the larger community. You can say UC Irvine, you can say you're where you grew up or your home, and then you also don't have maybe support from your biological family. So all of these things can definitely play into, again, causing more of those physical manifestations of stress. So it's super important to make sure you're having those support systems. And then again, for your spiritual health, some of us don't have that support from certain religious institutions that we grew up inside of, right? So then you're having to negotiate what it's like to be queer, LGBT in places or spaces that for you were once, was just where you thought you were invited, right? Like every Sunday or however you participated in religious institutions, you're having to negotiate that, and then figure around what you thought were family values, or what's told to you that the family should consist of, right? You're going to be going against that in a way, and you're having to make sense of that too. So all of this, like I said, comes back to how do we respond in our brains and in our our central nervous system, and also with, like I mentioned, that HPA axis. What's going on in our physiology once you have all of these things affecting your mental, emotional, spiritual health. So I hope that makes sense to people. I'm trying now to get, what I'm trying to do is finish this conversation in an hour so we can leave some time for questions. But this slide here I love this chart because at the end of the day, stress, right? And stress, we think about it in just kind of like being stressed out about, a test or something. But if you think about it in a more, like I mentioned, how it affects your physiology, there's all these things that could potentially make the situation around your stress and cortisol worse. So then there's a perceived stress, right? So anxiety, depression, how that leads to stress, or mental emotional factors that lead to stress. And you can see at the top, right, what would fall into that category. So burnout, maybe from school, relationships. Then you have some other factors here. I didn't talk really about some of the neurotransmitters in your brain that can cause the way that you perceive stress to be different. And then on the right in the green, you'll see different other things that can cause stress, and that's not poor sleep habits. It can mess your circadian rhythm, which tell you when to go to sleep and when to wake up. I think I mentioned that briefly as well. And then making sure that you're eating correctly, making the right nutritional choices when it's time to eat, because all that can cause more of a blood sugar dysregulation, like I mentioned, that can further cause more stress. And then you also have certain things that are related to, so like diseases or allergies, or infectious diseases, allergies, some cardiovascular issues. inflammation in the gut, all of these things start to cause an inflammatory pathway that leads to stress as well. So think about this, because at the end of the day, like I said, you want to protect your the way that your adrenals function and the way that you're able to respond to stressors when it becomes so when you do come across a really stressful situation, you may not be able to respond to it appropriately because of your poor adrenal health. So what I always tell people too, then I try to simplify it for students and for people when I say, when you start addressing your adrenal health, it really is as easy as, seemingly easy as making sure that you're eating well, exercising, drinking enough water, sleeping 8 hours a night, and all that's going to help support your adrenal health. And then also finding the emotional support, and that again comes back to LAFA and other maybe people in your community that can help, that would give that support, something like PFLAG in Espanol. And if the most important thing too that I want to drive home is that a lot of the times there are resources available to you to help with that mental, emotional stress. And you just have to, and it's one of those things that I didn't take advantage of enough while I was in school. And so there are ways for you to get therapy, right? And so oftentimes we think of therapy being something that you need when in a crisis, but it doesn't have to be in a situation where you're in crisis. It can be something that you're just doing every week because it's good for your health. Because sometimes we don't know we need the therapy until we really start taking, we start getting the therapy. So that's one of the last things that I'll leave you with is to all of those, it's easier said than done to eat healthy, exercise, drink water, sleep 8 hours a night, and to protect your adrenal health, and to get therapy. But really, you just think about those things, meditate on those things every day, and ask yourself too, always check in and ask yourself, like, what do I need today? Like, what, as soon as you start feeling a little bit like you're losing control, or you need some you need some time alone to just sit, always start with that. Like, what do I need? Do I need water? Do I need to eat? Do I need to sleep? Do I need to call somebody because I just need to get something off my chest? Or do I need to try and get into therapy somewhere as soon as possible? Like, always ask yourself those questions. So I want to leave some time for questions with you all. It's almost been an hour. So do you want to open that up?
Yes, of course. And thank you so much, Dr. Anguino, for that very wonderful talk and all the resources that you shared with us all. I was wondering if anyone today has any questions they'd like to ask him, or I have a question just to begin off, if that's okay.
Yeah.
One question that I wanted to ask you, just because I was interested in learning more about your work with naturopathic medicine, I was wondering, is it often that you see clients that identify as QTPOC? And if so, what are some of the concerns that maybe you see them reporting more? And how do you engage some of the things you talked about today in your practice with them?
Yeah, so early on, I did a lot of work with hormone replacement therapy in California mostly. And I worked for a company where they, it was cash pay. And at the time, the trans patients that would come to us were coming for the tools that they need for their transition, right? So they wanted hormone therapy. So it wasn't a lot, and it always be people that were able to afford it on the spot, right? Because they were coming to us, and we were a cash pay model. So oftentimes in that sense, I would, I would talk about always how the adrenal health, like I mentioned, how your adrenal health can disrupt a lot of things. particularly your hormones. And so whenever someone's being given hormone replacement therapy or being treated for a low hormone issue, we always go back to talking about the adrenal health and stressors. Because that can throw, if we're trying to bring balance to somebody's hormone profile, if we're trying to change the way somebody's hormones look, so that they reflect the gender that they're wanting to transition into, then you don't want any outside factors to come into play. And so with hormone replacement therapy, you're pretty aggressive. You're using hormones to cause a shift in the body. But you still can cause, you still want to make sure that everything is working in harmony. So you want to make sure that the thyroid is okay and that their adrenals are healthy. And that they're not getting any what are called endocrine disruptors in their everyday life. So endocrine disruptors are hormone disruptors. So if someone's not eating the right foods, or maybe foods that are really high in pesticides, or they're exposed to a lot of environmental toxins in their home, or they're not taking care of their just basic clinical nutrition, like I said, their nutrition, exercise, and sleeping well, and drinking enough water, all those things apply to everybody. And so that's always my approach. It doesn't matter if QTPOC or not, right? But I'm especially, I guess I care more about when I see somebody who comes in at the, so like in Phoenix, I oftentimes will get somebody who comes in and they don't outwardly identify as QTPOC, but just through the right question, the doctor-patient relationship and asking the right questions depending on what they need, then I know to kind of approach it in a different way. And then to think about the mental, emotional, spiritual health components and not just their physical health needs in that moment. That's always going to apply for somebody who comes in as QTPOC. I hope that helps, but if I answered that correctly.
Yes, it definitely helped. Thank you, Dr. Christian. Are there any other questions in the crowd?
Well, I have a question. So, if folks want to learn more about what you're doing, how can folks maybe hear from you more in terms of the other topics that your practice is based on?
Yeah, so I have an Instagram account. That's the easiest way. I do an IG live every Wednesday night, and where I invite a different guest speaker, usually another naturopathic doctor with a different expertise, and we go over just a different topic every Wednesday night. And there are some already saved on there. There's a whole talk on Latinx and mental health issues, on diabetes, and that one's in Spanish. If you ever wanted to have somebody in your family just watch that and it's in Spanish, that's saved on there as well. There's another one on women's hormones as well. So those are logged in and you can watch those at any time. And then every Wednesday night will be a different topic. There's one on there about sexual assault trauma and what it does to your physiology. Like I mentioned, some of it will be similar to what you heard here as well. Yeah. So and then through Instagram, you can see on that page, on the last slide, there's my handle. You can ask questions there, email me as well.
Well, thank you so much, Christian. It's been such a privilege to have you back on the campus. So for those of you, I didn't introduce myself at the beginning, but if you don't know me, my name's Adeli Duron, and I serve as the director of the UC Irvine Latinx Resource Center. So if we could just if maybe we can unmute and give him a big round of applause so he can actually hear our applause. So thank you so much, Christian. And for those of you that don't know, this is a series. And so what we are doing is honoring the work that La Familia has existed on this campus for nearly 20 years at this point, and want to bring back the alums because La Familia has been dormant this year, right? As part of what's happened with the pandemic. Mecha, La Cre, La Familia has been dormant. And so what we're trying to do with this series is energize students hopefully bring attention to the fact that this support group has existed in the past and inspire students to once again bring back this peer-to-peer student-led support group. And so we have another speaker next week, Dulce Garcia, in 1 week, so in 7 days, on May 18th at 5 p.m. And then on, hopefully I have the days right, May 25th, we have Liliana Gonzalez, Dr. Liliana Gonzalez, who will be speaking on QTPOC in academia. I'm trying to remember the titles. I'll go ahead and if somebody could share the flyer, I don't know if somebody has the flyer, but we can post it into the chat here for folks to see it and download it so that you have it. Thank you so much, everyone, for coming.